Hello everybody. So this is regarding chronic gastritis. This is usually identified histologically, and that is with the presence of inflammatory cell infiltrates, which usually consist of cells such as lymphocytes and plasma cells, and very scantily there is presence of neutrophil, or one can say there is very scanty neutrophil involvement. Distribution in case of chronic gastritis, that is patchy. Initially, it usually involves the superficial layers, and gradually there is the involvement of the glandular portion of gastric mucosa. This may progress to more severe glandular destruction, and that presents with atrophy and metaplasia. And henceforth, chronic gastritis has been classified according to the histologic characteristics, and this is based on superficial atrophic changes, and the second is the gastric atrophy. Okay, so superficial gastritis, what it causes? It causes a reddened edematous mucosa, and that is present with small erosions and hemorrhages. So the presentation in case of superficial gastritis, once again I am repeating, that causes a reddened edematous mucosa with small erosions and hemorrhages. Next is about atrophic gastritis. Now this occurs in all the layers of stomach. It develops frequently when it is associated with gastric ulcer and gastric cancer, and is invariably present even in case of pernicious anemia. It is characterized by decreased in the number of parietal cells. That is about atrophic gastritis. If we see what is an hypertrophic gastritis, it produces a dull and a nodular mucosa with irregular, thickened or nodular surface, and hemorrhages are frequent in case of hypertrophic gastritis. Chronic gastritis is also classified according to the predominant site of involvement, where type A, it refers to body predominant form, that is mostly in association with the autoimmune conditions, and type B, that is enteral predominant form. These are the parts of stomach, and this is mostly H. pylori related. The term AB gastritis, it is used to refer mixed enteral body picture. Etiology in case of chronic gastritis, it is like peptic ulcer diseases, infections with H. pylori, or gastric surgery. It can lead to chronic gastritis. Also, after gastric resection with a gastrojejunostomy, bile and the bile acids, it refluxes back to the remaining stomach, and this can cause gastritis. H. pylori infection and can lead to chronic atrophic gastritis, and age also is one of the factor, as chronic gastritis it is more commonly seen in elder adults. Pathophysiology in case of chronic gastritis, the stomach lining first becomes thickened and erythematous, and then it becomes thin and atrophic, that leads to continued deterioration and atrophy. Ultimately, it causes the loss of the function of parietal cells, the acid secretion decreases, and the patient develops an inability to absorb B12. Ultimately, that is pernicious anemia. Clinical manifestation: depression, presence with anorexia, feeling of fullness, dyspepsia, belching, vague epigastric pain, nausea, vomiting, intolerance of spicy and fatty foods. Investigations, if we see, the first is culture and sensitivity, that is 1 minute ultra rapid urease test. Now this is usually incubating gastric biopsy in urea broth, and that contains pH indicator phenol red. If H. pylori is present, then the urease would break down to urea with the release of ammonia. It will cause the rise in pH and the color change would occur. So this is about the 1 minute ultra rapid urease test. Second investigation is the breath test, also called as the urea breath test, in which you swallow a pill or liquid that contains stacked carbon molecule. If H. pylori is present, then the carbon is released when the solution comes in contact with the Helicobacter pylori in the stomach. Next is endoscopy, that is upper GI radiography, histological assessment to identify the cell type, serologic antibody test, and in cases of severe vomiting episodes, if it is coming, one may need to go with investigative tests such as serum electrolytes, hemoglobin, total leukocyte count, and differential leukocyte count. Complications may develop such as bleeding, pernicious anemia, and gastric cancer. Management in case of chronic gastritis: bland diet, small frequent meals, H2 receptor antagonist, proton pump inhibitors, and avoidance of food that triggers or that causes such manifestations. If Helicobacter pylori is present, antibiotics and the other medications are administered, and that is to eliminate the bacteria. If pernicious anemia develops, intramuscular injections of vitamin B12 are to be administered. Usually these are administered monthly, but so as be the case. So this is all about chronic gastritis. Hope you like it. Thank you for watching.